Hello, everybody. So I start my presentation. I talk about the disease transmission classification for climate-sensitive disease modeling. So the context is, in collaboration with Yasmin Almeida, a PhD student, I'm co-supervising together Claudia Codesso from Oswaldo Cruz Foundation. We developed a protocol to classify dengue transmission regime in Brazil. So this type of classification based on features of the epidemiological cycle in each location has the potential to increase the precision of surveillance and control strategies. This is the paper you can find using this link from PLOS Neglected Tropical Disease. So, in Harmonize project previously mentioned by Dr. Rachel Lowe, one of the objectives is to build digital toolkits to allow researchers and users to link, interrogate, and use multi-scale spatiotemporal data to understand the links between environmental change and infectious disease risk in their local context, and to build robust early warning system in low resource settings. So here is an example of harmonized user case with the following objectives. So we are planning to apply and validate the methods in other countries and to apply the protocol to other climate-sensitive diseases and also to identify changes in transmission regimes and their drivers. Now I will try to explain a little bit the protocols we developed in this previous paper and to understand well, so what is app features? So to clarify these concepts here, app features are features used to describe the shape of the epidemiological time series. So this was proposed at first by Taba and colleagues for respiratory diseases. With app features, we were able to classify areas according to different dengue transmission regimes, range from episodic to persistent transmission. And these regimes can be used to monitor changes on the disease transmission patterns, capturing the introduction, establishment, maintenance, shift, and more rarely, the extinction of disease in a given region. So, and how to apply it? To summarize the proposed protocol, this is the flow chart. You can see the detailed methodology on the paper, but here I'm just trying to explain very fast. At first, we need to collect the data and organize from the different sources like health data and sociodemographic data. After, we calculated the app features for each year and did some Pearson correlations to matrix to reduce the descriptors. Previously, we calculated something like 13 descriptors, and after this correlation, we had 10 descriptors. So after that, we calculate a mean of the app features for each municipality because we did it for a municipality resolution in Brazil. And, and after to calculate the app features, we did some cluster analysis to obtain the clusters. And with the clusters, we did an interpretation that gave to us the transmission regimes for dengue. And to do this interpretation, we use some demographic and also a climate information. And here is a table with all the app features we calculated. And one example is like the peak amplitude. That means the maximum value of incident cases per week in epidemiological years. Also, we have a length of the period of cases. From this app feature, we have 5 features, you know, and depends the characteristic we would like to extract, you can obtain different different numbers, different indicators here. So here is the maps for 6 states in Brazil. The polygons is the municipalities for each state. And here we can see the persistent transmission, regime, epidemic, episodic, and the episodic epidemic regime. The Paraná state is a nice example that you can see for this area that's mostly green and blue polygons. We have the episodic and episodic epidemic regimes, and this is the temperate climate area. And the area you can see most yellow colors is most tropical climate. Here is the table with the main characteristic of the transmission regimes. So from episodic regime, the main characteristic is irregular and low frequency occurrence of dengue in a certain location. And the disease in these places is sustained for a short period. And also we can see a low incidence. For the opposite, you have the persistent transmission. And at these municipalities, we have a regular and high dengue incidence in a specific location and few or no periods with no cases. And so the transmission sustained for long periods. So, and now the perspectives is to apply these methods for the other disease and also to identify some changes on the regime's transmissions and their drives. To do it, we will apply the app features for each year and now do the cluster analysis for each year. And after that, modeling it and try to, with some climate and socio-economic variables, and try to find the drivers of these changes in these patterns of regimes. This is a very important approach, because now we can make possible to evaluate and to measure the impact of these drives and these changes, and also expect these results to monitor disease and as a base of elaborate predictive models, because each regime has distinct characteristics and also needs different indicators and model approaches. So that's it. Thank you.